What is this? Does anybody know what this kit is? It's a blood and body spill kit. Blood spill kits in the nurses' stations and the med courts. If anybody has a blood spill or any body fluids, everything we need is in this kit. A red bag, glasses, the whole PPE, and everything to clean it up. Nurses, you have them in your med courts. They're in every med room. So blood spill kits. We have goggles and gowns and everything else we need in each hopper room as well. Okay? So a blood spill kit is all over the building. We have them placed in different places that they're easily accessed. All right? So this is a blood spill kit. This is what it looks like. And everything we need to take care of a blood or body fluid is in here. Eye wash stations. Do you know where they are? We have one right there in that little maintenance hall. We have in the bathroom, in the employee bathrooms. Hopper rooms have eye wash stations. Laundry has one. So we have eye wash stations. The kitchen has one. We have eye wash stations all over the building if anything gets in your eyes. Okay, this binder is the SDS binder. Hazard Communication Master Binder. SDS binder, it's every chemical that we use in the building, there's a sheet on it that tells what is in the chemical and what do we need to do. The poison control phone number's in here. Let's talk about real fast. Transfers, falls. What do we do for transfers? The communication sheets are made by Halls, and it has all needs on the communication sheet. Like what? Who has a Foley and what's the diagnosis? Special diets, transfer needs, a one person, a two person with a lifter. I want to go over right now real quick. How do we use a lifter? Can everybody see me? First of all, how many people to use a lifter? 2 people at all times to use a lifter. Okay. Surface to surface is the big deal. We have to have surface to surface. Here's the head of the bed. We back up the resident's wheelchair to the head of the bed. We have the lifter in front here. We make sure the legs are under, one leg under the wheelchair, one leg under the bed, and we move accordingly. We make sure the bed is locked. We move the resident surface to surface, one person behind. When the lifter comes to hold this bar, one person here, behind, working this deal. If we need a third, we can always have someone on this side of the bed to maneuver the resident. So we could have someone on the opposite side of the bed, someone at the head, someone at the foot, and surface to surface. You never, ever, ever transfer someone not surface to surface. Got it? You never swing someone around the room in a lifter. Why? Let's talk about lifter pads. Can lifter pads bust? Yes. We always check before you use a lifter pad. Never use a lifter pad without checking it. You check it for fraying, for tears, for oldness. If you see fraying or tears on a lifter pad, do you use it? No. You go, put it in the trash, and get a new one. You never use a lifter pad that is at risk for busting. A lifter pad has black, blue, purple, yellow on it. The straps. I always say use the third strap. The third strap gets hooked up here. We hook up the straps here, and then we lift. It is very important that we check lifter pads before using them for tears and fraying and oldness. Then you put it under the resident. Then we always have the resident surface to surface. So what about if the room's crowded and we can't do this, like this perfect, because we have all this room? It's our job as nurses, and CNAs to make the space to properly use the equipment. If we need to call the family and say, we cannot properly use our equipment because of the clutter or because of whatever, we need to call the family and identify the problem. There should never be an excuse why you can't use equipment properly. We need to figure it out. We need to get everybody's thoughts in line, and we need to figure it out. So it's always important to use equipment properly and to make sure that you have all access to do the right thing all day, every day. This is how we use a lifter, surface to surface. Always the wheelchair at the head of the bed, the lifter on this side, and we go. You can use, it's mandatory 2 people, but you can always get a third to stand on the other side to grab the resident. Whatever you need to do to safely transfer the resident, safety on you and safety on the resident is the most important thing you can do. Okay? Transfers is to make sure that the resident does not get injured. What happens during transfers? Skin tears, bruising, all these things. I've seen where this bar hit someone in the forehead. Why did that happen? Because no one was standing here. I've seen where people get skin tears because their extremities are outward. Extremities, we need to always ask them to do this or this in the lifter pad and make their feet cross the best way you can to put extremities inward and not have extremities flopping around. If someone's on an anticoagulant therapy, like what? What's an anticoagulant? Coumadin, Plavix, Xarelto, aspirin. They are high risk for bruising and bleeding. It is all the more reason to make sure that we're using utmost precautions with transfers, especially in a lifter. This is not an easy process, but we need to practice and make sure that we get the technique down, that the resident is not in pain. We make sure we're safe doing it. We need to take care of our backs too, and that's the whole point of having lifters. Once you have a resident that can no longer stand and no longer help themselves, you need to make sure you report it to me, to therapy, to nurses, to everyone, that therapy screens and therapy starts working with them. If it's to the point that they cannot anymore assist, then we start the lifter program. Okay, so everyone understands crystal clear, surface to surface. Checking lifter pads, making sure it's a safe, effective event.